It's my pleasure to welcome you to tonight's program. There's a few housekeeping things first. If anybody is an EMT paramedic, there's a sign-in sheet out there so you can get credit for this. And most of you have first-hand knowledge about what we're going to be talking about tonight. Also, there are restrooms in the front for those of you who have the need to do that. There are refreshments in the back. Feel free either now or at the end of the lecture to help yourself to those. There will be some question and answers after this. And there are feedback sheets either on your chairs or available for you. Please fill those out. And if you have any interest in programs in the future, let us know about those. We try and meet people's needs about what they're looking for. If you have any other questions, you can either talk to me after the program, and as I said, the speakers are available for questions and answers. So tonight, both of our speakers are from the Massachusetts General Hospital Department of Psychiatry. Dr. Paola Pedrelli is the Assistant Professor of Psychology at Harvard Medical School, and she is the Director of the Dual Diagnosis Study at Mass General Hospital. Her research focuses on people with both affective disorders and alcohol use disorders. She's the Principal Investigator of a federally funded study on treatments for binge drinking and depressive symptoms in young adults, and of one study funded by the ABMRF and the Foundation for Alcohol Research examining pathways to binge drinking for college students. She earned her PhD in clinical psychology from the Joint Doctoral Program at the University of California, San Diego, and San Diego State University. She completed her clinical internship at the University of Washington School of Medicine. Dr. Amy Yule, another speaker tonight, is the Assistant in Psychiatry at Massachusetts General. She is a clinical instructor at Harvard Medical School. She is a psychiatrist in the Addiction and Recovery Management Service, which is a clinic that serves adolescents and young adults under the age of 26 if they have substance abuse disorders. Her research examines risk factors for the development of adolescent substance abuse disorders, particularly risk associated with active parental substance use and abuse. She's a graduate of the David Geffen School of Medicine at UCal in Los Angeles. She completed her training in adult psychiatry and did a fellowship in child and adolescent psychiatry at the Massachusetts General Hospital, McLean Hospital. So tonight, hopefully we'll have a great lecture. As I said, questions and answers afterwards. I'm interested to find out what they have to say because all too often, weekend after weekend, in my job at Cooley Dickinson, I do see, and I will say, college-age students who present with alcohol-related problems. And again, just because you're 18, we can't specifically say you're from a particular college, but when you are 18 or 19 and you're brought in, people assume that you're from a particular college. But because we have 5 colleges in this area, they do attract college-age students from out of the area. So we see not just students from our area colleges, but also people who are attracted into the area because of the other colleges that are here. So our speakers.
Well, thank you for this opportunity to be here. We're excited to talk about this topic, and it sounds like a lot of people in the audience have a lot of experience with this topic, and so we also welcome your thoughts and questions as well. So to get started, I do have a disclosure that I was a recipient of a small research award through a professional organization that was sponsored by Eli Lilly. I won't be talking about any medications during this talk, but wanted to disclose that. So tonight we're going to talk a little bit about what is binge drinking, how common is binge drinking, what are some of the medical and psychiatric complications associated with binge drinking, and what are some effective interventions to address binge drinking. And then also talk about a clinical example that's probably going to feel or seem pretty common to you guys, or something that you also may have seen. So what exactly is binge drinking? I think if you talk to kind of somewhat generally, people think of binge drinking as drinking a lot of alcohol in a short amount of time and being very intoxicated. In 2004, the National Institute of Alcohol Abuse and Alcoholism defined binge drinking as drinking enough alcohol to get your blood alcohol concentration up to 0.08 grams per deciliter within 2 hours, and that is the legal limit for driving. For what does that mean for a male and a female? For most men, that does mean 5 standard drinks, and for for women that needs 4 standard drinks. So it does raise a question of what is a standard drink. It can mean a lot of, it varies based on what you're drinking, so and what the percentage of alcohol is in the drink that you're consuming. So it's 1.5 ounces of hard liquor is the equivalent to 12 ounces of beer, based on the fact that hard liquor has a much higher concentration of alcohol within the liquid than beer does. So the hard part in talking about young adults, and also college students in particular, is that their standard drink is a red Solo cup, and they often have no idea what they're drinking. And so that could be filled with beer, that could be filled with some random mixed drink that had a ton of hard liquor. It's often really hard to get a sense of how much they're drinking, and they often don't know how much they're drinking. So when you try to educate them on what is binge drinking, a big part of the educational piece is often talking about a standard drink and what that means, since most of them kind of think in terms of a large red cup and drinking large red cups. But what they're drinking within the large red cup really matters and can influence their risk of running into complications related to drinking. So how common is binge drinking? And this is from data from the National Survey of Health and Drug Use that was done in 2011. It's a yearly study that's done nationally in people over the age of 12. And so this looks at, over here, the percent using within the past month. Within the study, they often ask, or they do ask, how much have you been using over the past year, how much have you been using over the past month, and then also over the past week. And so this gives you a picture of, for people over the age of 12, how many people are both binge drinking, and in this study, binge drinking was defined as one episode of drinking 5 drinks at a time, and how many people are drinking heavily. And heavy alcohol use is defined as 5 binge episodes within a month. So as you can see, there's a really steep curve here, so that between 16 and 17, to 21 to 25, the prevalence and the prevalence of drinking generally increases quite dramatically. And then you can see that overall that it's peaking here at the age in 21 to 25-year-olds. And this is also when we see the peak age for binge drinking. So about 40% in this study, looking nationally at how many people are, or what are people's drinking patterns, 40% of people are binge drinking in the 21 to 25-year-old age range. So that's a lot of people drinking. I mean, it's interesting to note, though, that there are some 21 to 25-year-olds that weren't drinking over the past month, and then some that were drinking in a way that wasn't creating kind of medical risk, or just using, not binging, and not using heavily. But I think we are pretty concerned about this large number of binge drinkers and people that were drinking heavily. So one thing to think about is that was kind of looking generally at people 18 to 25. And when you look at the 21 to 25-year-olds and separate by whether or not they're attending college, you do see that people that are enrolled in a 4-year college full-time drink more, or binge drink more than people that are not enrolled in college full-time. So this is specifically looking at binge drinking over the past month. And down below you can see the trends over the past 10 years. And so this is over here 2011, where you see that about 40% of people that are enrolled in college full-time are binge drinking, and 35% of people that aren't enrolled in college are binge drinking. So something about being at college, which I think we think is in part influenced by the availability of alcohol and the number of people around you drinking, does influence drinking patterns. So it is, important to make a distinction between binge drinking and then an alcohol use disorder. And so a lot of the national studies that you'll see publicized in the news or come out in journals are often looking at assessing the frequency and quantity of how much people are drinking, and don't assess for an alcohol use disorder such as abuse or alcohol dependence. And it is an important distinction to make in terms of treatment, because our interventions that we would recommend do vary based on whether or not someone might have alcohol abuse versus dependence versus binge drinking. And so this is a study from the early 2000s that looked at 14,000 college students. And they did find that there were a lot of people that were binge drinking heavily, which is defined as 3 episodes of binge drinking over 2 weeks. And that those people that were drinking heavily were more likely to have an alcohol use disorder. So if you were binge drinking heavily, you were 19 times more likely to meet criteria for alcohol dependence. And then the kind of overall, if you looked at all 14,000 students, 30% met criteria for alcohol abuse, and then 6% met criteria for alcohol dependence. So I think that kind of the scarier statistic here is just that out of those people that make criteria for alcohol dependence, only 6.2% of them sought treatment. So there are a lot of college-age students that are drinking very heavily, putting themselves at a lot of risk that aren't getting any help or support. So that kind of does lead us to, it's important to define, what is an alcohol use disorder, and something to be aware of is that in May 2013, the American Psychiatric Association came out with new criteria for how we define substance use disorders, and it does reflect that that it's not just that you have alcohol abuse or dependence, it's often a spectrum of an illness. So this reflects more of that, and that things are classified as either having alcohol use disorder, mild, moderate, or severe. And to meet criteria for an alcohol use disorder, there's a total of 11 criteria. So you need to have had at least 2 of those criteria over the past year. And so what we often see, so overall it's a maladaptive pattern of substance use, so using in a problematic way associated with 2 or more of these criteria. And in people that are binge drinking, we often see that they do develop tolerance over time, so they need to drink more to have a similar effect. And then they also are often spending a lot of time drinking and recovering from their substance use. So binge drinking, as kind of we looked at before, is something that's going to increase the likelihood that you have an actual substance use disorder. So these are some of you have in your handouts, the other criteria. And we often sometimes present this to patients and kind of say, does any of this seem to apply to you? What do you think of this? As a way to give them some feedback about their drinking patterns or drug use patterns. So this kind of brings us to something that I think the audience can speak to and that you guys see on a regular basis with 35,000 college students around. But that there are a lot of problems associated with binge drinking in college-age students. And so these were studies that looked specifically at college students, not at young adults. And they did find that 1,800 students died related or had an unintentional injury that led to death while they're intoxicated. And most of that was from hypothermia, and then a portion of it was also from falls. So there's a lot of people that do end up dying while intoxicated from falling or from exposure or whatnot. And then I do generally think that we do a fair job in terms of public service announcements about the importance of not driving while intoxicated. But it's a little alarming to see that in 2005, 3.4 million college students, so approximately 30% of college students, drove while intoxicated, putting themselves and other people at risk. And then the kind of other things that are associated with problems associated with binge drinking include just general injuries, so hitting your head, loss of consciousness, a concussion, a sprained ankle, a broken leg, a broken arm. That's 10.5% of college students have that happen to them while they're drinking. And then 12% of college students and then 2% of college students have either been physically or sexually assaulted by somebody who's intoxicated. So not that they're intoxicated themselves, but by being in an environment, potentially where there are a lot of people binge drinking or heavily binge drinking, they're at increased risk for assault. So how does alcohol lead to these problems? Alcohol affects many different parts of your body, but as psychiatrists and psychologists, we're often interested in how it's affecting the brain. And the interesting thing to note is that alcohol does affect, some parts of the brain are more sensitive to alcohol than other parts, particularly the hippocampus, which is the area of memory formation. And so that's how people often black out. So they may seem like they're not that, they may seem intoxicated, but not that impaired, and that they're kind of walking okay and their speech is kind of okay. but they may have no memory of what they were doing when they were kind of walking and kind of talking okay. And that's because the hippocampus is much more sensitive to alcohol, and it's going to be more impacted by alcohol than that area of the brain that controls walking, or the cerebellum. And so it just is important to know, kind of notice where the areas of the brain that are affected by alcohol. And we'll get to this when we talk about some of the more acute medical complications, but that alcohol does affect the brainstem, and that's how, or it's toxic to the brainstem, and that's how it can lead to overdose and death from alcohol. So we also do have some data about long-term effects of heavy alcohol use on the developing brain. And I think another reason why we get worried and nervous about these kids are that, their brain's still developing, and the brain development continues through adolescence and into young adulthood. The parts of the brain that are changing the most during this age, this time period, include the prefrontal cortex, and that's the part of your brain that helps you with decision making and planning and organization. And then the hippocampus, which again is where memories are formed and is your memory. And so they did find that they compared people with no alcohol use histories or no alcohol use with people that met criteria for alcohol dependence who had been sober for 3 weeks. So these aren't people that are intoxicated, they've been sober for a good amount of time, and I think most of us would think that their brains had probably returned to normal functioning. But what they did find was that in these kids that had met criteria for alcohol dependence, after being sober for 3 weeks, that they had significantly worse delayed recall of verbal and nonverbal information. So it is having a kind of a longer term impact on their functioning and their memory and recall. They also found in a different study looking at, it was a smaller study, these studies generally are hard to do, but about 20 subjects looking at adolescents who met criteria for alcohol dependence versus controls or healthy controls, and did find that in these adolescents that their hippocampus was much smaller in the people that met criteria for alcohol dependence. And so that's also concerning that you're having kind of significant structural changes to the brain related to alcohol use. So kind of the acute effects of alcohol, it sounds like you guys might see on the street on a Friday or Saturday night, and you know about that kind of at lower doses, people are often a little bit happier, kind of maybe a little bit more active, relaxed, they're less inhibited. But at higher doses, which is where they end up often being observed or monitored or transferred to the hospital, it can cause drowsiness, slurred speech, nausea, emotional mobility, problems with coordination, impaired memory, sexual dysfunction, and loss of consciousness. And alcohol poisoning is a real phenomenon, which unfortunately it sounds like, again, you guys know about here. But there were 68,000 people brought to emergency rooms and hospitalized due to alcohol poisoning in 2008 nationally. So that's a lot of kids that are ending up in the emergency room hospitalized related to the effect of alcohol. And so some of the signs and symptoms which are really a medical emergency and are very concerning do include mental confusion, stupor. Someone might be sleepy, but you should still be able to arouse them. So they're unarousable, that's a concerning sign. Vomiting, seizures, slowed breathing, pale skin, and that their temperature is getting lower. And some of these things are related to just the effect of alcohol on the brainstem. And then the other thing just to be aware of, especially for college students to be aware of, is that after someone passes out, depending on their drinking pattern over the night, their alcohol levels still could be on the rise. And so they're still at an increased risk even though they've stopped drinking because they passed out. And so those are just some important points. And I'm going to turn it over to Dr. Pedrelli to talk about some of the other consequences.
So after this point, we'll be talking more about the associated with drinking and some of the problems associated with binge drinking. What I wanted to talk at this point is about more the psychiatric problem associated with binge drinking and maybe some option that we have to address this problem. So the first thing that I want to talk about is the fact that oftentimes the students, they tend to drink more in the context of some psychiatric problems, specifically depression, anxiety, and poor overall mental health. And this is a chart where I try to portray different association between different things. So several studies have shown that psychological distress or greater mental health problems are associated with more alcohol-related problems. And there are a few reasons for this. So there are a lot of students that they have anxiety or depression or overall distress, and they really have low tolerance for this state, and so they turn to alcohol, which is something that the same as drink to cope or self-medication hypothesis. And so when they do tend to drink to cope, they tend to drink more, but also they also use less protective behaviors. And when we talk about protective behaviors, are having designated drivers, or pacing yourself, or maybe thinking at the beginning of the night how much you're going to drink for that night. And again, we have, as Amy was saying, it's really difficult for a student to know how much they're drinking because the red cup. So sometimes what we do in session, we actually tell them to maybe shift to drinking a beer, a bottle of beer. I have some patient that keep the cap for each beer they have, so maybe they know at the end of the night how much they're drinking. And so, but I feel like what's really interesting here is that a lot of people think that more problems associated with more drinking, but that's not really the only thing you need to think about. It's really how the students are drinking. So they really can think, they need to learn a little bit how to drink, so no drinking games. And we'll talk about at the end maybe some suggestions that we want to talk about with them. So the other thing that is really highly associated with alcohol is unfortunately only 1/3 of the students who drink only. The majority of the students who engage in binge drinking, they also use other substances. So 2/3 have used in the previous year many substances in addition to alcohol, and the most common substance that is used is marijuana. More than half of the students use alcohol, they binge drink and use marijuana, with all the associated problems, of course, that come with using illegal substances as well. As Amy has mentioned, even though binge drinking is associated with numerous problems, there is a very low percentage of people with alcohol problem that they seek treatment. So she referred to one study. This is another study done by Blanco and colleagues in 2008, where they found that only 5% of college students, alcohol users or alcohol problem, they sought treatment, which is interesting how different it is from the students with depression, only where 1 out of 3 students with depression actually seek treatment. And this is something I wanted to mention. And so there are a lot of different ways you can engage students who are drinking. And one of the ways actually at the counseling center, when you see them with depression, it's always very important to screen for alcohol use or drug use, because almost half of the depressed students are going to engage in binge drinking. They might not report it because, of course, they don't think that they need to address that. So, in light of the fact that, as we have seen, in light of the fact that there's such a low prevalence of students with alcohol problems that seek treatment, NIAAA has outlined different steps that they should be taken in order to address this problem. So the first step is asking. So screening is incredibly important to detect this problem, to act. Asking about quantity, frequency of alcohol consumption, frequency of binge drinking. The second step would be to assess. So what kind of problems are associated with alcohol use? Could be academic problem, could be at a level, a different level. Could be academic, could be social, could be behavioral, could be medical problem, as Amy has illustrated. And it's also important to assess all the psychiatric problems that can co-occur with alcohol, as we was talking about, depression or anxiety or illegal substances. Then at that point, of course, in light of the assessment, referral is needed at this point. And depending upon the severity of the problem, different intervention can be suggested. So it could be brief intervention or initial interviewing, which I'll talk in a minute, and referral maybe to a higher level of care if maybe severe alcohol use disorder is present. So example of
screening can be frequency. You can ask on average how many days per week do you drink alcohol, and this is very key to ask. And it might be silly to think about this, but some people just ask, "Do you drink?" which is the worst thing you could ask. You really always want to ask when you imply that maybe there's alcohol consumption. So ask about how often do you are drinking, how much on a typical day when you drink, how many drinks do you have, and frequency, how many times do you have more than 4 or 5 drinks on a single occasion last 30 days. Another frequently used instrument is the audit, and the audit is 8 questions, but the first 3 seems to be very sensitive to detect alcohol problem. And also here, similarly, one would ask how often do you have a drink containing alcohol, or how many drinks would you have on a single occasion, and how often would you have 6 or more drinks on one occasion. And a score of 3 and 4, 3 for women, 4 for men, it indicates a risk alcohol consumption. With regard to guidelines, this was outlined by NHAAA, and these are guidelines that are used more in primary care context or environment. But so I don't know how it's helpful for binge drinker, but just to give you indication of guidelines are 4 standard drinks for men, and 14 per day, 14 in a week, or no more than 3 per day, and for women, and no more than 7 per week for women. And even though what I was saying, screening is extremely important to detect alcohol problems, because again, the binge drinker are not going to present themselves. Unfortunately, it's not something that is done on a regular basis at many colleges. Winters and colleagues conducted a study when they surveyed something like 300 colleges, and they sampled colleges that were representative of the nation, and not even half of the colleges actually were conducting formal screening in the counseling centers. And out of these 44 out of these colleges, only 1 out of 5 were actually using instruments that were validated for this population, and the rest of the colleges were using maybe screen that they identified, or they were using, or they developed, and they were not necessarily valid. We don't know that. So with regard to what to do, NHAAA outlined those. So in 2007, because of all this information that we've been having for a while, how severe is the problem, there was a task on college students that was organized by NHAAA. And out of this task, out of this meeting, where all the experts basically analyzed all the data that we had at this point, they outlined several suggestions how what to do. And so they suggest to act upon a different level. And at an individual level, what they suggest to do is to use brief motivational interviewing, and a combination of CBT techniques with motivational interviewing and norm clarification, and also intervention that would use challenge alcohol expectancies. And what I'm going to be focused now is more motivational interviewing, because this is an intervention that is being widely used to address a lot of unhealthy behavior, including alcohol, and it's been shown that it's quite effective with this population. And just to give you an idea, a little bit of MI, motivational interviewing is based on the trans-theoretical model of Prochaska, and they posit that every behavior, in order to be changed, to go through a different set of stages. So, and I always give this example out of about going to the gym. So someone doesn't just wake up and go to the gym. There's a different steps that would come up before actually one, right? There's a change. So there's you have a pre-contemplation where someone doesn't even think that the behavior needs to be changed or has negative consequences. Then you go through contemplation, preparation, action, maintenance, and relapse. And this is actually very important to outline, because if you introduce the idea of change when someone is in the pre-contemplation stage, in the pre-contemplation stage, you'll have a lot of resistance. And so the person is, we talk about teachable moments, the person is not going to be open to hear suggestions or any ideas how to actually you're going to implement the change. Very important is to get from contemplation to preparation and action when you really want to talk about change. And so what MI does is basically facilitate this movement from one stage of change to another stage towards behavior change. And it's client-centered, and it explores patients' ambivalence about what they're doing and their goals. And specifically try to really increase the discrepancy between, for example, I'm drinking a lot and all my friends are drinking a lot, but I really also want to maintain my scholarship. And if I keep drinking, then my scholarship is going to go away and I'm going to be kicked out of college and my parents are really going to be mad at me. So you really want to discuss this problem and come up with maybe a commitment to change what they're doing. And something that is very characteristic and very important in MI is a style of communication. So you're going to help this change by expressing empathy and acceptance of current behavior. So it always was about a little bit of tough love when you were talking about changing somebody unhealthy behavior like drinking or addiction. And we have seen that really doesn't help. So sitting with the patient in a way that express empathy and non-judgment is very important. And so this is also done with a series of communication skills. And so it's very important to use open-ended questions, such as telling a little bit about your drinking. Affirmation, which is supposed to increase self-efficacy, so the confidence in one person that they actually can implement the change, that they're going to be able to follow through with whatever they commit to with you. Reflective listening is very important, so you're feeling that you're drinking as much as your friends, and yet, again, you don't like that you black out, or you don't like the fact that you yell at your friend while you're intoxicated and they're mad at you, or you're really or you don't like the fact that your friends always complain because they have to take care of you and they have to bring you home every time. So you always want to present both sides of the story in a non-judgmental way. And summarizing is, as it says, so basically summarizing whatever you have talked about during the meeting at the end. So what you decided today is to avoid drinking games. These are a few alcohol reduction tests that can be, again, explored with the student. And we were trying with something that I mentioned already, such as I'm big into the drinking games is the fastest way to get really drunk really fast. And so that usually the first thing that you want to discuss, whether they engage in drinking games or not, they'd be open to not participating in those. Avoiding hard liquor, because of course that when they drink hard liquor, they get intoxicated quite fast, and then spacing the drinks, I think, slowly. The other thing that unfortunately is happening in girls nowadays is that they want to drink like the boys, and they don't understand that their biology is very different. So we just have more water, we don't have enough, and so we can process alcohol as much as the guys. So a woman the same size of a guy is going to drink as much as the guy is going to be much more intoxicated. So they can't really keep up. And the other important thing is to maybe at the beginning of the night decide how much they're going to drink, and then stick to that limit. This is something that sometimes people might say, which is very interesting. The minute you start talking about alcohol, they're going to say, I'm not alcoholic, all my friends drink as much as I do, drinking is normal in college, that's what everybody do. And And also they minimize, of course, what happened at that mall. Everybody black out, that's not a big deal. You might black out, but then you get in trouble, so that's okay. Basics is states for brief alcohol screening intervention for college students. It's intervention that has been developed at the University of Washington, and it uses motivational interviewing, and it's based on providing personalized feedback. So basically, the student report how much they're drinking, how frequently, and what kind of problem they might have had in the previous month, and all the information is fed back to them and is analyzed, and again with an MI style, and in this context, they oftentimes understand that maybe they're drinking more than they're comfortable with, they're having more problems that they're comfortable with, and it's being effective in reducing the alcohol use. With regard to shift to, so we'll be talking about the individual level, what can be done, so what can be done more in the general population. So enforcing, that's really very important, it works. And so enforcing the drinking age laws, I think we have some people that are helping with that. Trying to prevent alcohol consumption on campus, and reducing outlets. So again, accessibility is very important. So if you don't have access to alcohol, it will be very difficult for you to want to consume alcohol. Increased prices and taxes on alcohol is being helpful to reduce alcohol consumption. And also ban marketing of alcohol on campus is being very helpful. And I think that's something that is happening here to really, for the hospital and the campuses to work together, and the police and enforcement to all work together to find policy that would reduce alcohol use. With regard to campus, what campuses can do, these are strategies that might help. We don't really know yet, but we need a lot more studies. So I love the scheduling. It's been shown that if there are Friday classes, Thursday night drinking is actually reduced somewhat. Then it might help to have safe rides program, so then people don't drink and drive. Then it's going to be, there's some information about talking, informing parents, because they're really part of the equation. So sometimes it's helpful to have the parents involved, and they might help out with reducing drinking. Unfortunately, there's this myth that, again, it's just a rite of passage, and sometimes parents don't understand that if your child is transported or is getting in trouble, they're not just having fun. It's a really bad red flag. Ineffective intervention, again, education, awareness programs are really not helpful, and this is something that some campuses are still not understanding. Educational law is not very good.
So we're just going to briefly review a case that I saw in the clinic that I work in for with young adults of a 21-year-old from a local college campus in Boston. And she presented originally with depression and anxiety to her primary care doctor and got referred to us for psychiatric care. And when she came, was very much more focused on her psychiatric symptoms and talked about a history of depression beginning in adolescence after a loss. And then significant anxiety starting when she started college, so didn't have anxiety that much during high school or latency age, but once she started college, started having panic attacks, increased anxiety in social situations. And then if you look at her substance use history, she did drink alcohol earlier, not kind of at a super early age, but at 16. Her use during high school was fairly infrequent. But then when she got to college, she really felt like she could not go to a social event sober and started drinking very heavily. And actually had a hospitalization within her first month at college due to alcohol poisoning, and ended up having 2 within her first 2 years of college. Started around when she presented for care, started having periods of agitation and aggression where she tried to hit a couple of her friends, was banging her head against a wall, which is, she's this very mild-mannered, very sweet, calm girl when you meet her when she's not intoxicated. So this, also in particular, these periods of agitation and aggression more stress within her about her behaviors. So she did end up being related to her psychiatric and substance use difficulties, took a medical leave about this approximately a year prior to presenting to us due to an episode of depression. Was started on an antidepressant, Zoloft or sertraline, but really struggled with taking it consistently, which I think is one other aspect of working with young adults is it's kind of acceptance of illness that a lot of them, struggle around kind of needing to take medication on a daily basis, needing to go see a psychiatrist or needing to go see a therapist. I get a lot of like, why do I have to come in to see you? So that's just something that's hard for this age group in particular. So she did continue to drink in Boston on her medical leave, but upon going home, stopped and really didn't drink at all when she was at home. And then she came back to school in the winter, tried to monitor her alcohol use, but was really struggling to do so. Really couldn't tell us how much she was drinking, but was drinking about 3 to 4 days a week. Was having blackouts. Was trying to do some harm reduction strategies like changing the water when she felt dizzy. And did have a goal to not feel compelled to keep drinking heavily when she started drinking. But other than that, didn't really view her alcohol use as a major problem, except for kind of having had those periods of agitation and then also the strong urge to keep drinking when she started drinking. But since returning to school was really struggling again with her anxiety, needed to drop a class because she had so much social anxiety in that class. So when she came to see us, she was really concerned more again about her psychiatric symptoms, particularly her anxiety and mood. And then had also started to notice that she was having a lot of concentration and memory difficulties. And so that's kind of how she presented to us. I think, kind of thinking about the case, it would have been great if she presented to us back here. So, and I don't know kind of what happened when she was hospitalized then. Would have also been great if she had presented for more care when she had her medical leave. It seems like her family's not really as aware of what's going on. Our model of care that we try to use is really incorporating the family into the treatment plan, which I think you guys probably experience as well. It's much more challenging when it's a college student presenting for care and her family's not in Maryland. They don't really know what's going on, and she doesn't want them to know what's going on. And so you can try to use the motivational strategies to increase her willingness to get the family involved. But often it's not until they detox that you really have more leverage to get the family involved. It'd be nice to have them more involved before somebody needs to go to detox. So the other kind of things to highlight too are just having the more recent difficulty with her memory, and she was quite surprised that I thought that was related to her alcohol use, and she was also quite surprised and shocked and really had a panic attack when I told her she met criteria for an alcohol use disorder. So again, just really not a lot of insight, and was presenting around one of the psychiatric symptoms, which is what Dr. Pedrelli mentioned as well, that people will come in for their concern about their psychiatric symptoms. There's high likelihood that they have a comorbid substance use disorder, but they're not as concerned about that or don't have great awareness of how problematic their use is. So,
well, I think actually, I don't know whether to say whether it's nice or not, but I think that unfortunately the ones with anxiety and mood disorder are the ones that were able to engage more because they have more commitment to gain something from treatment. So if it feels that the students with a pure alcohol use disorder without anxiety or mood or anything else, it's going to take them more years and more losses and more problems before they really engage with treatment. Whereas that's what I'm studying, because the people with depression and binge drinking, they really don't want to be depressed. That's really their motivation to come to treatment. And fortunately, that's what it is, so that it's kind of your hook. And then in that context, you're also able to talk about the binge drinking or the alcohol use disorder. So in one way, it's unfortunate because it's a more complicated, more complex picture when you have the mood or the anxiety on board plus the alcohol use. But those are the people that maybe you can see earlier, and they're going to be more engaged in treatment because they do want this full loss. They do want to be anti-anxiety, and so and while you talk about the depression and when they don't want to get out of bed, then you also talk about the binge drinking and how that's really not a good strategy to cope with their mood. And the other piece, again, also when the aunt, I wonder what would have happened if the college, and I don't know whether that was the case, but whether whether she had been identified the first week of freshman year, and maybe identified and get some counseling, get some skills, because again, there's a lot of students who, and that's really concerning to me. You have unfortunately paid their work completely different. We go to school late, we stay there forever, and we have a lot of support. But here you have young adults, 18, with an incredible amount of responsibility. They shift from basically spending their time with their parents, that they've been driving around, and their schedule is tightly organized by their parents, where they have to go to college, where they sleep all day, they don't know when to sleep, they don't know when to eat, they don't know how to manage their schedule because they're just not used to it. And again, their brain is not developed. They really don't know how to do time management, they don't know how to communicate effectively yet. And so it's starting college is incredibly traumatic for the students. And here you have someone who's already has vulnerability for anxiety, depression, and drinking, doesn't know how to communicate. She's kind of doomed at that point to become this way. And so I don't know whether there can be more screening to identify people who are drinking, or maybe people who are not as much skilled with regards to communicating to manage their time, and maybe they can be referred to the counseling center now that they're busy enough. But
yeah. I think the other mixed part is in this community, you only have one hospital, whereas I think she probably went to a couple different hospitals over the course of her treatment, and so it might be, I think it's a little sometimes harder to connect the information that she was in the hospital back to the school. But one other strategy that we often use with young adults is sobriety sampling. Kind of, well, why don't, could you think you could try to give it like 2 weeks without drinking, or try a month without drinking, and see, if your anxiety is different or if your mood's different. It's often hard to get their buy-in, because that feels like forever to them. Just in terms of waiting for their anxiety to get better for a month feels like forever. But sometimes you are able to get their buy-in, and then they notice after a period of time, oh, I'm drinking less, or I'm not drinking at all, my mood is a lot better. So kind of throwing it out there as an option, or giving them a menu of options, can sometimes help with their engagement. Those are some of our thoughts about this case. I don't know if you guys have other pieces or other questions or other comments about the presentation that's out there.
So there's a microphone there if you want to stand. And if you're not shy, give your name and what you do.
My name is Steve Pillow. I'm actually a cardiologist here at Cooley Dickinson. But I'm here as a parent. I was just, not to diminish the immediate effects of the alcohol on memory and on brain function, but is there any longitudinal data that tells us whether these binge drinking behaviors are causing permanent brain damage and loss of memory that's more permanent?
Yes, there's not a ton, but I think what we do see is that people that are binge drinking and then kind of binge drinking more frequently often do meet criteria for an alcohol use disorder. And so the data that's out there is more around people that met criteria for alcohol dependence. So there's not a lot specifically on binge drinkers, but I do think that a good percentage of the binge drinkers meet criteria for alcohol dependence. And so then there's more long-term data from someone out of San Diego that Dr. Pedrelli got to work with, Dr. Brown. And she had a very interesting study 4 years out. Unfortunately, in terms of answering your question, it was with alcohol and drug use disorder, so it wasn't alcohol specifically. But they did find that in comparison to people that never had heavy alcohol or drug use, or never had problematic alcohol or drug use, compared to people who had problematic use and either had been abstaining, so sober for a period of time, and then also people who were still using, that their recall and memory and executive functioning skills were significantly poorer than the people that had never drank. And then in terms of a gradient, the people that were actively using, they were poorer than the people that had abstained. But the people who did have problematic use a long time ago were still, you did see still deficits.
So something that I don't remember exactly how to this specific study, but I think what we know more is that pattern of drinking doesn't really change. So again, a lot of people think they're going to mature out, and it's true, some do, but many don't. So we see that 4 to 7 years later, a lot of people who were binge drinking in school, here they are 27, 28, supposed to function and have good jobs, they're still binge drinking. And so those good jobs really are not, they're not able to keep those jobs. And so they might drop out from school. So there's, I think the binge drinking problem is something that is acutely problem, so they can die now or have an injury now, and there's also long-term effect that that we're seeing. But the brain, we still need to do a little bit more work.
More questions? People must have more questions, particularly people from UMass.
Or comments?
I wanted to offer, my name is Anita, and I'm a recently retired teacher and a mother and a grandmother. And I'm here because I'm a grandmother. I don't want to see my children go through some of the same things I went through with them. What I see here is a picture of a person who has a classic ADD to begin with. And she started with that. She'll never be totally rid of it. She can get rid of the drinking, but that's the strategies that you will give her will always be helpful in that way.
Yeah, like, or people with attention deficit hyperactivity disorder, combined hyperinattentive, definitely can benefit from behavioral interventions to help them with, and that's the executive functioning, and that's the part of the brain that's still developing during late adolescence. I think the one thing that's often kind of under-recognized is just that depression and anxiety also have a big impact on concentration and organization and planning. But with her, it didn't elicit as much of a history of ADHD when she was younger. In terms of, I always try to, it's these kids that come in, they're not really wanting to engage in like a 2-hour session about all the details of their life and their history. But I often use a strategy of just, what were you like as a kid, to try to get a better sense of what their functioning was like in elementary and middle school, to help give me some clues around whether or not, ADHD might be present. Psychiatric comorbidity is like ADHD or conduct disorder or bipolar disorder. Those are definite risk factors for developing a substance use disorder later on in life and earlier and more severe substance use disorders. The good, in terms of specifically around ADHD, and these are the really impulsive kids who I think we all worry about going out and drinking. If they're treated, that can decrease their risk back to, the general population risk, and so they're not as elevated in risk. I think, although often people worry about making medication that can be misused, and you do need to think about what type of medication you give them, and I think probably another question or another lecture, thinking about medication options for people with comorbid psychiatric illness, for college-age students, and also might be using other substances that they may or may not tell you about. And so if you always, as a prescriber, want to think about the risk associated with the medication that you're prescribing, how much of the quantity that you give them, and then how often you're seeing them. So I like to see these kids often. And fortunately, I'm in a practice where I have the luxury where I can, bring them back in 2 weeks instead of maybe in a month, or see them back in a month instead of 3 months, just to keep an eye on them. But
I think like the comment, I was thinking also about the fact that there's definitely a lot of comorbidity when it comes to alcohol. So you have ADD, and with the problem with ADD, there's highly comorbid with alcohol use problem. And also, again, if you have ADD and you are on campus trying to organize your life, it's going to be incredibly difficult. And so it's very important to have services and specific help to organize your life so that you don't get so overwhelmed or so distressed that at that point either there's abuse of drugs or there's abuse of alcohol to manage all this anxiety, all this problems that are associated with it. And the other thing that many of these cases speak to is things, and there's director of counseling center that can definitely speak to that. Up to 10 years ago, a lot of students, a lot of adolescents with behavioral problems like depression, ADD, unfortunately they weren't diagnosed, they were not treated, so they were not making it to the college. So now the good news is a lot of students make it to college. The bad news is that now they're in college, they need a lot of services to stay in college. And here we have students with anxiety, depression, ADD, autism, unfortunately psychotic disorder, and again, they're in this environment that is incredibly stressful, and they have their own behavioral problems to deal with. And here you are, you have drug use, you have alcohol problems, and so so there's good news that they're making it to college. Now we really need to keep them in college and rather in college in a healthy and safe way.
So we do, and the community should be aware of this, we do actually have an advantage, and I think the doctors alluded to it. There is one hospital that most of these college-age students go to, number one. And number two, again, UMass and the other 4 colleges collaborate with us at least a couple of times a year. We meet with UMass and some other behavioral health people every month, and UMass started a great peer review program. So I think we're actually maybe a little ahead of the curve because of some of the advantages we have locally. So it's a problem, but I think after tonight, we have some other things that we can utilize to markedly reduce that in conjunction with what we're doing already.
The other thing just to point out is that our government has invested a lot of time and resources into studying these things. We still have a lot of unanswered questions, but we referenced the National Institute of Alcohol Abuse and Alcoholism. They have a wonderful, fantastic website specifically devoted to college and drinking. And so they came up with some of the task force recommendations that we mentioned. And if you're just curious and want to learn more, it's a great, easy to read website to look at.
So we have time for one more question.
My name is Herb Horace. I'm a retired district court judge from Greenfield, and I ran a drug court. And now I serve as a community member on the Restorative Justice Board of the Eastern Hampshire Court. And we do get students before us that have alcohol problems. But what I'm curious about, you continually refer to binge drinkers, but not alcoholics. I'm wondering if you can just relate the two, and whether there's a difference in treatment, if there is a distinction between those two terms.
Well, I think, it's always hard because as a researcher, I keep getting lost in the definition. So there's definitely a difference in definition. So the binge drinker, as Dr. Yule was saying, is defined as consuming 4 drinks for women and 5 drinks for men in 2 hours. And so with binge drinking, we focus more on toxicity, and we focus on that, and we've seen a lot that binge drinking is associated with a lot of problems, even though maybe they don't have an addiction. That's what happened is we used to really focus a lot on addiction and alcohol dependence, alcohol abuse, and provide treatment when people had gone through so much losses. Now, I think in the past couple of decades, we've seen that it's not really just about the addiction, it's really about the toxicity that is associated with a lot of problems. That's what Dr. Yule was saying, is even if you maybe don't meet criteria for alcohol abuse or alcohol dependence or the new criteria of addiction, people can have a lot of problems. So they might sexually assault someone, even though maybe they binge drink once a weekend. And maybe they might not meet criteria up to that point for addiction, but they still can get in trouble. Or maybe they might fall from a balcony, even though up to that point maybe they're not alcoholic. So I think when we need a label like alcoholic, people think about maybe the homeless guy that can get a job, or the person who's fired. There's plenty of people who drink heavily and they can function at some level, but not at some other level. So that's why we're talking more about consumption rather than having the old definition of alcoholic. And now, again, Dr. Yule, and that's why eligibility actually changed, or not, if the APA has changed the definition of addiction. We are going away from the alcohol abuse and alcohol dependence, whereas thinking that addiction is really on a continuum, where you can have a few problems and then another problem, the severe spectrum. And so that's very helpful. In one way, there were a lot of criticism because we're thinking now everybody's addicted because a lot of people are going to meet the strict criteria. But I think that once we step away from that criticism, it's important to know that we just have to have more of an actual conversation about alcohol and how plenty of people are affected even though they still have a job or they're still married or they have kids and maybe they have a normal life, but there's a lot of that.
Add to that, just, I mean, often when you meet these kids, you ask them like, well, how much do you drink, or to what point are you drinking, or kind of what's your goal with drinking? And they're like, what are you talking about? Like, you know, I mean, I think people think about drinking and think about a dose often when they're drinking more responsibly. And these kids just have like, they're really drinking to get drunk, and it's very scary. And drinking to get drunk more quickly by not eating before drinking, and then drinking hard liquor, and they're just getting into trouble. It worries us, but.
Okay, thank you very much.